A day after allowing limited resumption of air traffic from the United Kingdom, where a more virulent coronavirus strain has led to record rise in daily numbers, the Health Ministry issued guidelines for stricter surveillance and testing of the passengers from the United Kingdom. Let's go across to Sukirti Dwivedi for more on this. Sukirti, what are the new guidelines?
Well, yes, Rohit, there have been certain change in rules. There were earlier SOPs when the UK passengers were being allowed. That at that point also there was RT-PCR test on arrival. But this time there is a certain changes have been made to the new guidelines. One, for example, has been that this time for the RT-PCR test, all the passengers arriving from UK, they will be tested on arrival, but they will have to pay on their own for these tests. Until now, it was the government who was facilitating the payments for these tests, but this time individuals will have to pay for it. Also, even if one tests negative in the RT-PCR test, they will have to go for home quarantine of 14 days. Last time, the deadline or the time duration for that was supposed to be 7 days. Now that has been extended to 14 days. So these are among the two big changes that have been made, and also the DGCA this time is monitoring that all those who are traveling from UK to India do not come via a third country. There has to be no transit flight. So basically there are no layover flights that they can take. You have to directly take a flight from UK and land in India. You cannot land in any other third country as a layover. So that concept has been completely prohibited, and this is in order to ensure that we do not miss out on the testing process of any passenger who could potentially have the UK mutant strain. So in order to implement all the testing guidelines strictly, these are the rules that have been formulated now by the ministry. So paying by the individuals, all the RT-PCR tests now self-paid, and also the fact that home quarantine is now 14 days instead of 7 days for all those who test even negative.